OSA. What is this sleep apnea syndrome that we always talk about related to obesity? Now, there is no direct connection between obesity, hypoventilation syndrome as we said, or sleep apnea syndrome, or inability to breathe, or even snoring at times, getting up at night because you can't breathe, or sitting and sleeping. All these are related to your morbid obesity. Now, would it mean that you have deposition of fat inside your neck and you can't breathe? To some extent, yes. It also means that you have a large amount of fat deposit inside your tummy. Your intra-abdominal pressure increases. The diaphragm or the muscles of respiration cannot do the activity the way they are supposed to do. And when you lie supine, they push up, thereby your lungs cannot expand and you have a hunger for more air. And this can be dangerous. And when I say dangerous, it means very dangerous. It can actually cost you your life. So obesity hypoventilation syndrome, which starts with a simple snoring or apnea spells or sleeping by sitting at night, can be very dangerous. It should be treated and addressed at the earliest. We must talk to your pulmonologist, talk to your physician, and see to it that you have done something about it. Even if you need a sleep study, you must undergo a sleep study. Don't think that it is just a way of living life. Absolutely not. The feeling of choking when you're sleeping, the feeling of being sleepy all the times, by the feeling of sleeping the moment you get 2 or 3 minutes free during your office. You sleep when you're driving or when you're being driven. And there are patients and there are people who actually sleep while even driving. It can be dangerous. It is absolutely inviting death to your doorstep. So obesity, hypoventilation syndrome, or sleep apnea syndrome, or breathing difficulty should be treated at the earliest. And the best part about this bariatric and the metabolic surgery is this is one of the few things which are going to get over. So if you are using a CPAP or a BiPAP, these are small little machines that you use for breathing. You must continue using them, and post bariatric surgery, I can almost assure you, within months you would be donating your machines. You would be off all these machines. You can breathe well. You can have a normal sleeping pattern. Your snoring is gone. Snoring gone means it's also good for your partner and neighbors at times, right? So you would feel happy. You would have a better breath, a better personality, and you will